And thank you for joining us today for what is going to be a really great conversation about how we better meet the needs and support children of immigrants. Before we get started, I really want to welcome our panelists here with us today and thank them for taking the time to share their insights and their expertise with us. So let me just kind of briefly talk about who we have with us. We have Renato Rocha with CLASP. We have Hamutal Bernstein with the Urban Institute. And we have Gabrielle Tilley with the California Food Policy Advocates. And then we have Lizeth Mendoza with the Inland, I want to say Inland Empire because I'm from California, but the Inland Coalition for Immigrant Justice. So really glad that we could have them here with us today. And if we were all in person, we'd give them a big round of applause and welcome them. So before we get started, let me just share a little bit about Share Our Strength and who we are. We're an organization dedicated to ending hunger and poverty, and we work through various programs to address that. So as you can see here, under the Share Our Strength umbrella, it's the No Kid Hungry campaign, our Cooking Matters program that provides nutrition education, and our Community Wealth Partners that helps nonprofit organizations. So with that, why don't we start with a few housekeeping issues, or I should say rules here. So before, we just want to make sure that you use the chat box if you're having any difficulties, that there will be a recording of this webinar that we will email to all of you who've registered, and you could share it widely for anyone who really missed this great conversation. And then if you have any questions for the speakers, please be sure to use the Q&A box. We want to make sure that we get to all of your questions and we're able to respond to them in a timely manner. So with that, why don't we just go ahead and get started and do some context setting here. As you know, we're in the midst of this national health crisis, and we've seen every single day just, the astounding data around child hunger. We're seeing that more than 11 million children are missing meals and continue to be in households that struggle to meet their basic needs. But for immigrant children, this has really been compounded and exacerbated by policies and rules that have really, set the stage for immigrant children to really feel this pandemic even more. And we're going to get into that. We have some data here, and I'm not going to go through all of them, but I do want to really kind of point out a couple of things. And that is that what we're really seeing on the ground is that immigrant children who are in split status families are not accessing the programs that they're eligible to receive that would help to prevent them from being food insecure. We also know that prior to the pandemic, there was the public charge rule that really has become a double whammy for their families. So that chilling effect of the public charge rule has only made this pandemic even worse for those kids who are in immigrant households with split status families, split status. The other thing we also want to talk about is the programs and the benefits that immigrant children are eligible to receive. And we want to make sure that all of you are really aware and that you have an opportunity to ask questions about what children are eligible to receive. So for example, we know that immigrant children through this pandemic are eligible to receive Pandemic EBT and SNAP and school meals, and as well WIC. So we want to make sure that we take this opportunity and take advantage of this esteemed panel and ask them all the questions you want to ask them with respect to immigrant children being able to get the nutrition they need to survive this pandemic. So with that, let me turn it over to Renato Rocha with CLASP, who will kick us off on today's panel. Thank you.
Wonderful. Hi, everyone. Thank you for the invitation to Share Our Strength for having me on this webinar. My name is Renato Rocha. I'm a senior policy analyst at CLASP. And for those of you who may not be familiar with CLASP, CLASP is a national nonpartisan anti-poverty organization located in DC. And I'm also the deputy campaign director of the Protecting Immigrant Families Campaign, or PIF Campaign. Next slide, please. So let me start off by naming that the COVID-19 pandemic has dramatically altered the daily lives of our nation's children and families, as Monica was raising in the introduction. While everyone is experiencing the pandemic's effects, we know that families with low incomes, communities of color, immigrant families who have been economically marginalized are facing increased economic uncertainty and struggling to put food on the table. Millions of children depended on school or childcare for healthy meals during the day. Before COVID-19, on average per day, more than 30 million children received free or reduced price lunches through the National School Lunch Program. And with many schools still closed today, it's important to know what resources are available for immigrant families with children, which is especially important to consider when about a quarter of our nation's children are children of immigrants. So today I'm here to talk about eligibility for nutrition programs for immigrant families and provide a high-level overview of one of the barriers to accessing nutrition assistance for immigrant families, and that's the public charge policy and its pervasive chilling effect on program participation. And as providers, advocates, friends of Share Our Strength, you are an incredibly important piece of the puzzle when it comes to education. And you might be wondering, why that's the case. Where we are seeing and are already seeing a big chilling effect is among people who aren't directly affected by public charge, like US citizen kids with immigrant parents, or people in programs that aren't implicated in the policy, like WIC or Pandemic EBT. And that's why understanding the policy is incredibly important to helping families fight fear and be able to help put food on the table for their children. So towards the end of my presentation, I'll provide some suggested messages when talking to community about public charge and flag a couple places where you can find more information and resources. Next slide, please. So before I jump into an overview of nutrition assistance programs and public charge, I want to reiterate the disproportionate impact on food insecurity and the COVID-19 crisis on communities of color, immigrant families that Monica had raised at the start. So just this week, the Urban Institute released new data on food insecurity trends during the pandemic. And researchers found that parents, Hispanic and Black adults, adults living with at least one non-citizen individual were significantly more likely to be food insecure than their counterparts. And when considering these disparities, I want to just keep these stark, significant differences and disparities in food insecurities in mind when we look at potential programs that can help fight against hunger and their immigration-related restrictions. Next slide, please. So here are nutrition assistance programs available to fight food insecurity, split into two main buckets. So up top are programs with some immigration-related eligibility restrictions, and that is federal SNAP and state-funded food assistance programs. And below are programs with no immigration-related eligibility restrictions. WIC, and I'll get to why there's an asterisk in a moment, a Pandemic EBT, school meals, including grab-and-go meals, food pantries, and other state and local COVID-related assistance. So we'll now take a closer look at these programs. Next slide, please. So let's, of course, start with our nation's cornerstone of nutrition assistance programs, and that's federal SNAP. It's a powerful anti-poverty tool, which in 2016 lifted 3.3 million children out of poverty. And as you can see from the list, SNAP is only available to certain categories of non-citizens. For some humanitarian immigrants like refugees and asylees listed there in the middle of the slide, SNAP is available immediately without a waiting period. Other non-citizens like undocumented immigrants or DACA recipients listed at the bottom are completely ineligible for SNAP. Green card holders fall into a middle category. They can qualify for SNAP, but only if they meet a condition the most common condition is the 5-year bar. So after 5 years, as a lawful permanent resident or green card holder, they can qualify for federal SNAP. And there are a few exemptions here, most notably, especially for our conversation, for children. Children under age 18 who are green card holders do not have a waiting period. Their parents can apply for them even if the parents aren't eligible. Next slide, please. In some states, state-funded programs provide nutrition assistance to immigrants who are not eligible for coverage under federal SNAP. And the table in front of you lists these states' programs in California, Connecticut, Illinois, Maine, Minnesota, and Washington, and also describe the immigrants eligible for these state-funded programs. And I'll talk more about public charge a bit later in the presentation, but want to flag here as well that for folks that state-funded nutrition programs are not considered in a public charge determination. Next slide, please. So next is WIC. WIC provides nutritious food to eligible pregnant, breastfeeding, and postpartum women, as well as infants and children. And WIC is one of the few federal assistance programs that Congress elected not to limit eligibility on the basis of citizenship or immigration status. And WIC applications do not require any information about immigration status with the exception of Indiana. And that's the reason for that asterisk at the beginning of the presentation. And I'll also note that participants can be approved for WIC without being physically present in a local office. And this isn't targeted to immigrants, but for immigrant families who are worried about the anti-immigrant climate, who hesitate to be physically present in a government office, this is especially beneficial. Next slide, please. So next on the list of anti-hunger programs is the Pandemic Electronic Benefit Transfer Program, also known as PBT. And this program provides nutritional resources to families who are losing access to free or reduced price school meals due to school closures in response to COVID-19. The first round of benefits were issued in the spring, and the second round of benefits are available this fall for children enrolled in schools operating fully remotely or operating a hybrid in-person model. And families can also get grab-and-go meals and PBT. And PBT is available regardless of immigration status. And for many families that have been excluded from other COVID-19 relief like stimulus payments during the pandemic, PBT may be many immigrant families' only new resource available to help them weather this challenging time. Next slide, please. So the last type of anti-hunger program that I'll cover are state and local COVID-related assistance. During COVID-19 crisis, several cities have stepped up to fill the gap left by federal relief and have provided nutrition assistance and cash support to immigrant families. And examples of these immigrant-inclusive responses to the COVID-19 crisis include Austin, Texas, where funds are available for social service providers to ensure food access and other direct services. In Seattle, Washington, the city is providing supermarket vouchers to families, and if additional funding becomes available, has stated that immigrants and refugees should be prioritized. And in Los Angeles, where the city is providing assistance to families in low-income households that suffered a job loss or loss of income, regardless of immigration status. Next slide, please. But the reality is that even when children and immigrant families are eligible for these nutrition programs, there are still barriers accessing nutrition assistance, including during the pandemic. And one of these barriers is the Trump administration's public charge policy and its chilling effect on program participation. And there's been lots of research in this space, including from Hamutal and her colleagues, who found that about 1 in 5 adults in immigrant families with children reported that they or a family member avoided a public benefit like SNAP because of immigration concerns. So I'm now going to transition my presentation. For the second half, I'll talk in more detail about public charge policy, share information about the status of the policy and the programs included or not included in the policy. Next slide, please. So first, let's take a look at what is public charge and its history before jumping into what's changed. The public charge test is not new. In fact, it's been part of federal immigration law for over 100 years. And the term public charge has historically referred to a person who is considered likely to become primarily dependent on the government for support. So although the public charge test has been around for a long time, the test has been very limited in scope. Next slide, please. And the concept of public charge is deeply rooted in discrimination, and changes to public charge fit into a long history of attempting to restrict immigration based on race and ethnicity. And according to analysis by the Migration Policy Institute, the regulation is likely to cause a significant shift in origins of immigrants seeking visas and green cards away from countries like Mexico or in regions like Central America and more towards countries in Europe. Next slide, please. And in front of you is a quick overview of the 3 agencies and the 3 sets of regulations that touch on public charge policy. And I'm going to flag the status of each of these regulations here as well. So from left to right, both the State Department and the Department of Homeland Security have pursued changes to the public charge inadmissibility rule. The State Department policy applies to applications of visas or green cards processed outside of the United States. And this State Department policy is blocked by a preliminary injunction, meaning that the Department of State policy is not in effect. The Department of Homeland Security policy applies to applicants of visas or green cards processed inside the United States. And this Department of Homeland Security policy has been implemented nationwide as of February 24th, 2020. And to the right, the Department of Justice public charge policy applies to lawfully present immigrants that have already been admitted to the United States. And the Department of Justice has not yet issued proposed changes to this policy. So just to quickly recap, the Department of State policy is not in effect. The Department of Homeland Security policy is in effect nationwide, and the Department of Justice has not yet proposed changes to public charge policy. Next slide, please. So public charge comes up in 3 main ways: when a person applies to enter the United States, when a person applies for a lawful permanent residency or a green card, or when a green card holder leaves the United States for 6 months or more and re-enters. So these are when public charge come up. And it's really important to remember that there is no public charge test when a green card holder applies to become a naturalized citizen. And this is one of the biggest misconceptions about public charge. I just wanted to raise that here as well. Next slide, please. Well, now let's take a look at how the public charge policy has changed. And it's changed in 3 drastic ways. First, the policy expands the definition of public charge. Second, the policy adds new factors to the Totality of Circumstances Test, which I'll cover in just a second. And lastly, the policy adds new benefits that can be considered in a public charge determination. And we're going to take a closer look at these changes. Next slide, please. So the public charge policy adds new factors to the Totality of Circumstances Test, which requires an immigration official to look at a person's life circumstances when making a public charge determination. And immigration officials will weigh these factors in either a positive or negative way. And in front of you are some of the weighed factors in the public charge policy. A heavily weighed factor, the only heavily weighed factor, is having income above 250% of the federal poverty level. The negatively weighed factors are not having a job, an age of either under 18 or over 61, income below 125% of the federal poverty level, a health condition, or receipt of one of the named public benefits. Next slide, please. So here are the public benefits considered in the public charge policy, which is one of the negative factors we saw in the previous slide. And the longstanding policy only considers 2 types of benefits: cash assistance for income maintenance, TANF, SSI, for example, and long-term care at government expense, both on the left side of the screen in front of you. The public charge policy now considers these 2 types of benefits plus adds the benefits towards the right-hand side of your screen, which is SNAP, Medicaid with some important exemptions listed at the bottom of the screen, which is Medicaid exemptions for emergency services, children under the age of 21, pregnant women, new mothers up to 60 days postpartum, and testing, treatment, and prevention of COVID-19. Housing assistance is now included, and state, local, and tribal cash assistance is also now included. I do want to flag that non-cash benefits not named in the regulation are not considered in a public charge determination. So we'll take a look at some of those non-cash benefits not included. Next slide, please. So here are a list of benefits that are not included in the policy. And it's important to keep in mind that this list is not exhaustive. It just reflects programs that we get the most questions about. So any benefit not listed in the regulation is not included. And there's been a lot of confusion about this because some earlier leaked drafts of the public charge proposed rule included programs like WIC, but the policy only includes the benefits that I described in the previous slide. And as you can see, WIC, school breakfast and lunch, PEBT, are not included in the public charge test. Next slide, please. So immigrant families in your programs or in the programs of your partners are certain to have questions about the policy and what changes mean for them. And the chilling effects I mentioned that Hamutal will talk about as well are very real. And here are some suggested messages to keep in mind when talking to immigrant families that are true regardless of whether or not the recent changes are in effect. And I won't touch on all these messages, but just wanted to flag two critical pieces, especially for this conversation. And that's one, a child's use of benefits, including SNAP, will not hurt a parent's future immigration application, meaning that parents should continue to enroll their eligible children in programs like SNAP that help children lead stronger, healthier lives. And the second piece is that public charge does not consider receipt of most benefit programs. And we just saw a long list that include WIC, school meals, PBT, food pantries, just to name a few. Next slide. So for those of you interested in additional resources, please visit the PIF Campaign's website at protectingimmigrantfamilies.org. We have a quick reference guide on immigrant eligibility for public benefits during COVID-19 listed there on your right. And I also want to bring your attention to a documentation project by our partners at FRAC and the Center on Budget that assess implementation of PEBT. And there's state-by-state profiles available on their website that folks may want to take a look at. And of course, Gabby and Lizeth will be sharing some absolutely great resources during their portion of the webinar that are amazing. Next slide, please. So lastly, a quick note about the PIF campaign that I mentioned at the beginning. For most of our existence, PIF's focus has been fighting back against the public charge threat. We started in 2017 with only a few dozen members, and today the campaign has more than 500 organizations or 500 active member organizations across the 40 states that are part of the PIF campaign. And if you're interested in joining the PIF campaign or connecting with partners in your state that are working on these issues, you're welcome to reach out to me, and I'd be happy to connect with you. So I'll now pass it to Monica to introduce our next speaker.
Renato, thank you so much for that presentation, and I think for answering some of the questions that were in the chat box early on about what is public charge and split status families. Let me turn it over to Hamutal from Bernstein from the Urban Institute. She is the Director of Program on Immigrants and Immigration. So really looking forward to her presentation as well. So Hamutal, the floor is yours. Thank you.
Thank you so much. I'm really excited to be with you today. Thank you, Renato, for giving a fantastic background on public charge. So I direct the Urban Institute's work on immigrants and immigration. The Urban Institute is a nonprofit research institute that's really committed to supporting evidence-driven practice and policy to foster the well-being of communities and people and places across the country. Our work on immigrants and immigration, we really work to surface the experience of immigrants and inform policymakers, advocates, service providers, philanthropists on how to develop immigrant inclusive policies. So if you all are not yet on our newsletter or haven't been familiar with our research and convening work around immigrants and refugees, I encourage you to check out that website and sign up for our newsletter there. There are a couple of great tools that might be helpful for your work. The Children of Immigrants data tool, which breaks down all these demographics down to the local level, all of our work around public charge, and the range of other work across the Institute that touches on immigrant families can be found there. Next slide. So today I'm going to share some results from a recent study that we released in late August, which we did in partnership with Renato and his colleagues at the Protecting Immigrant Families campaign. The work over the summer really built on a set of research that we've been conducting over the last few years to understand the chilling effects around the public charge rule and try to understand how to facilitate immigrant families' access to the safety net, both nutrition, healthcare, housing assistance, and the range of supports that Renato mentioned. So we know that fear and confusion is driving many families away from programs that they need. And the arrival of the COVID-19 crisis on top of these chilling effects is obviously a really frightening and worrisome intersection. So in the context of that, the public health emergency and the economic crisis that led to hardship for a lot of these families, we really wanted to see what we can do to understand what was going on. So what we did was we partnered with PIF, and PIF was in April collecting proposals for grants that they would be releasing to immigrant-serving organizations, CBOs, community-based organizations across the country. And we thought, as researchers, we could partner and try to tap into that network to find out what was going on in the immigrant-serving field and what was happening in immigrant communities around the country. So we ended up working with PIF to analyze these grant applications that they received and also fielding an online survey to those applicants to ask some more targeted questions. So what we were doing was tapping into kind of the early stages of the pandemic. So the survey results, which is the bulk of what I'll present today, was fielded to staff in these immigrant-serving organizations in the very end of May and into the first weeks of June. And we had 4 key research questions we were trying to answer in the study. What were the impacts of the crisis on immigrants and what were their most pressing needs? Were these chilling effects happening? Were they avoiding programs and support they needed for fear of immigration status or enforcement consequences? How were pandemic relief efforts at the federal, state, and local level supporting these communities, and what were the gaps? And what new challenges and opportunities were these organizations themselves facing, and what strategies were they using to support their communities? Next slide, please. One thing I just want to mention before we go into some of the findings, and it ended up being actually a quote from a survey respondent at an organization in Florida who noted a lot of the families won't be included in data and statistics because they've either given up trying to get benefits or don't try in the first place as they fear immigration penalties. So our answers, as in members of these CBOs, are reflective of families that have actually come forward seeking assistance. There are so many that have just remained in the shadows, as always. So I just like to share this slide because it's important to keep in mind that these survey results that I'm sharing are limited in this way, and they're really only showing a small sliver of what's actually going on in immigrant families and communities at this really difficult time. Next slide. So moving into the results, I'll be drawing a little bit on the qualitative information. with a focus mostly on the survey findings. I start here with a quote from one of the applications we reviewed, which really points to the confluence of challenges that families were facing. So staff have been fielding countless phone calls and emails on behalf of families seeking help to keep themselves afloat, finding food pantries, worried about evictions, keeping the power turned on. Many families won't benefit from the government aid available to U.S. citizens, such as unemployment benefits because of their immigration or employment status. Those who are able to apply for certain benefits face long waits and confusing changes to benefits as the crisis situation evolves. Some do qualify for some benefits or community assistance, but cannot access them because they cannot find information in their native language. Many constituents are reporting unsafe working conditions without adequate protective measures. Some have had their hours cut or been let go from their jobs without savings. Language barriers leave many in the dark about housing and job rights, life-saving community resources, and critical information about the virus to help keep their families safe. This was a very consistent story across the applications. The applications provided by these CBOs across the country painted a picture of enormous need in low-income immigrant communities who have been hurt by the economic hardship. They've lost income working in those industries that have been most affected by shutdowns, and on the flip side, also holding a lot of essential worker jobs and facing risk of exposure at work. They're facing multiple barriers to getting help, from eligibility rules to language access to limited information and confusion about a quickly changing policy landscape. So there's absolutely enormous need and very limited access to government supports. Next slide. When we asked our survey respondents to rank immigrant families' needs during the pandemic, respondents emphasized basic needs first. So 2/5, 40%, reported cash as either the first or second most pressing need, followed by food, 38%, employment, 37%, and housing, 31%. And you can see the other results along the side there. Healthcare is closely after that. Beyond these needs that we specifically listed in the survey, we saw additional key needs described in qualitative responses: costs for essential expenses like funerals, car repairs, bus fares, diapers, childcare, other really critical needs that these families were struggling to sustain. Now, although workplace safety came out a little bit lower on this list, the applications really focused on that topic, and many organizations describe this as a major area of concern for the families they serve. Lots of worry about unsafe working conditions, inadequate access to PPE, and especially stories around undocumented workers afraid to advocate for themselves at work. Next slide. Now, here are some of the chilling effects survey results. And you'll see we asked about a number of the programs that Renato mentioned in his earlier presentation. So overall, respondents reported that many immigrant families are avoiding public supports because of immigration concerns. Both standard kind of public assistance programs like food stamps and Medicaid, as well as these pandemic relief programs, which are listed on this figure. So if you look at the blue and the yellow bars on the left, that's the share of respondents who said either almost everyone or many immigrant families were avoiding these programs because of immigration concerns. So we have the pandemic unemployment at the top at 43%, the Paycheck Protection Program loans for small businesses, 34%, the stimulus payments, 29%, Pandemic EBT, a little below that. Fewer, but still large shares said that families were avoiding local programs like local emergency funds or local emergency rental assistance, the whole array of things that we see kind of popping up in certain places around the country that have popped up in the absence of federal support for many of these families. So I will also point out that the green on the right is the don't know responses, which is quite large, and including quite large on the pandemic EBT. That's important to keep in mind because it suggests there was some difficulty answering the question, and these staff and CBOs just didn't know what was going on at this stage, early June in the communities they're serving. Pandemic EBT is a little more, maybe was less known than things like the stimulus payment or the unemployment compensation, and it rolled out in states in sort of a sequential way. So that might explain part of the lack of understanding. There's also different ways these all programs were implemented, right? With whether you receive something automatically or you have to go to a website and sign up. So all of those implementation details underlie some of these big picture trends. What we take away from this is that we and the CBOs we just don't know a lot about which families are accessing which supports. So we need to understand more who is accessing the supports and who isn't, so that we can try to improve access across the board. Next slide. So we were also interested in the policy responses, and many states and localities have been active in these efforts to fill in the gaps left by federal legislation. The grant applications we reviewed mentioned initiatives across the country, describing applicants' involvement in efforts as partners, as advocates, as implementers. The survey asked how effective these state and local efforts have been in helping low-income immigrants in their communities across different areas of need. So again, the blue and the yellow is these programs have been very or somewhat effective at reaching this population. And it's interesting to note food is at the top. So about 80% said that state and local efforts around meeting basic needs on food have been very or somewhat effective in reaching immigrant families, followed by 56% reporting those levels for healthcare, lower on utilities and some of the other areas that we know localities and states are working on. Mental health came in at the bottom with only 24% saying these efforts have been very or somewhat effective. Next slide. So we're definitely seeing a lot of gaps for immigrant communities. When we asked why haven't state and local efforts been more effective in helping families, the exclusion of certain immigrant groups from relief efforts came out as the top reason. So 77% said that the exclusion of certain immigrant groups from relief efforts was the biggest reason they hadn't been effective at reaching them. 67% cited that limited funds cannot meet the need. 65% cited fear. So the fear of participating in programs in these families. That third bar around fear is certainly not just about public charge and the chilling effects around public charge. As Renato also mentioned, it is very difficult to disentangle the anti-immigrant climate, fear of immigration enforcement, and the specific chilling effects of the public charge rule. It all has come together to reduce access and increase fear in these families. And there was a lot of information in these applications, and CBOs really stressed immigration enforcement, cooperation with local police, harmful state and local policies, which also contribute to this climate of fear that deters families from getting help. Next slide. So in addition to some of these questions around the policy responses, we were interested in how this crisis was playing out in the immigrant-serving field and in the CBOs themselves, which some of you may be part of that group. So there's no chart for this result, but I'll share that about 2/5, 41% of survey respondents reported the crisis had affected their organization's ability to conduct its work a great deal. And another 40%, 38% reported that their organization had been affected a moderate amount. Not surprising. On this slide, we see when organizations were asked what the single greatest challenge was to conducting work during the crisis, 32% cited limited funding to support an increase in need, followed by 19% citing the technological challenges in reaching clients who they usually interacted with in person. Other top reasons included the unpredictability of the crisis and the risk that staff and clients face when providing in-person services. It was really, really interesting to read about the range of work going on in CBOs in the applications, how they were adapting their work to the crisis context and the types of partnerships that they were developing and implementing. The applications absolutely reported a flood of activity to meet the needs that had arisen during the crisis and a major pivot and a shift to operating remotely rather than in person. Next slide. So we were interested in finding out what the organizations were doing in those early stages of the crisis. So 78% said they were providing education and awareness about the crisis, 74% doing advocacy for immigrant-inclusive policies, 72% helping families apply for these programs. Interestingly, 69% had developed emergency support funds. We saw so much in those applications, lots of organizations putting together funds in different ways to get immediate, small but critical amounts of money to families to pay the most critical expenses, namely rent and food. Another key area of work applications described was communication efforts to educate families about the virus and ramping up messaging around the public charge rule to communicate that COVID-19 testing and treatment would not be considered in future public charge determinations. And I just want to say that shifting to virtual methods, creatively using different platforms, different digital platforms to reach the hard to reach people was a big theme in those applications, despite these barriers as well around limited digital access, limited digital literacy for a lot of the populations they normally reach. I think I have one more slide. In addition to the challenges, there was also information around new opportunities and new openings in the crisis. Some organizations really recognized kind of a new public attention to immigrants' well-being and concern over their exclusion from public benefits, given the disparities, that were well documented, just disparate effects on people of color and especially essential workers. So in some cases, we saw mentions of new collaborations with government agencies, innovative efforts at the state and local level. The first quote points out sort of a shift in perspective from the state agencies they work with normally. Because of COVID-19, state agencies are much more invested in learning about the barriers and needs of immigrant communities during this pandemic. This provides us with a unique opportunity to build new relationships with agencies and advocate for policy changes that reduce fears and expand benefits access for immigrant communities. And this digital turn, several also noted that the turn to digital communications has opened up some new audiences for them. So in this quote, an organization says, going virtual has helped our direct community outreach and education. We've been able to host a number of Facebook Live events and webinars, participate in similar events hosted by partner organizations and grassroots CBOs across the state. These resources are more widely viewed and shared and have interactive comments from the community than some for in-person outreach. So wrapping up, I'll just say this study that we conducted with PIF gave us a suggestive view of what was happening nationally at the early stage of the crisis. I'm really curious to hear your questions and your reactions on what resonated and what did not, maybe what we could revisit in our continuing work. We have so much more we need to understand about which supports are actually reaching families, immigrant families, and what is really happening for these families, especially those that are completely disconnected from CBO or government supports. And we also really need to understand better the impacts of fear around immigration enforcement apart from the chilling effect around the public charge rule specifically. It's something we have not addressed head on, and I think it's something we need to. So thank you for listening, and I'm looking forward to the rest of the conversation. Thanks.
Make sure I'm off mute here. So Hamutha, thank you for helping us to really understand the impacts in presenting this data, because I think it's really important that we understand just, how deep the chilling effect is and what the impact it has had on immigrants during this particular health crisis. Next, we're going to hear from Gabby Tilley from the California Food Policy Advocates, and Lizeth from the Inland Coalition. They're going to co-present. So thank you for being with us here today, and this will be our last presentation before we go to Q&A. So please get your questions ready. I'm sure you have a lot of really good questions for this panel. Thank you.
Thank you, Monica. And thank you, Renato and Hamilton, for setting up the context that immigrant families are living in right now. You set me up perfectly to talk about what we can all do to improve the quality of life for these families. So CFPA, California Food Policy Advocates, we are a statewide policy and advocacy organization that works to shape the programs and policies that should normally connect, but sometimes stand in the way of people and the food they need to thrive. And anti-immigrant policies, like public charge, are one of those. And it's a huge barrier for immigrant families, especially in California, when 50% of children live in immigrant families. It's a major priority of our work. So CFPA employs a range of advocacy strategies to break down these barriers. Of course, ending the discriminatory and exclusionary policies is our #1 priority. But part of that work is also mitigating the chilling effect to ensure that immigrant families stay connected to what they're eligible for currently. So next slide, please. So that's why we employ a range of strategies that all rely on partnerships and community. That's why my presentation today is in 3 parts, actually. I'll go over what we do as statewide advocates, what our partners at the San Diego Hunger Coalition do as regional advocates, and then what our partners at the Inland Coalition for Immigrant Justice do on the ground to reach community directly. Takes a village. So here's a snapshot of the work that we did during the COVID era, specifically directed to support immigrant nutrition. I'll go over the 2 things on the side, our work with the Protecting Immigrant Families Coalition and with San Diego. But we also, of course, as policy advocates, did a little bit of admin advocacy, particularly around PEBT. It came down to states having to determine how the program got rolled out. So we worked with the state on their messaging. It wasn't quite as a comforting public charge message as we wanted. So we shared some national PIF resources with them and some templates and sample text that they could use instead. And they did end up changing how they talked about public charge. So that was a win. We also got some media placed. We worked with our partners in San Diego to feature voices of parents who received PEBT or were looking forward to receiving PEBT, and that got shared widely. We also placed an op-ed about what the federal government can do to step up for immigrant families. And we also utilized our relationships with funders and philanthropy. We realized that they have connections to tons of CBOs who have connections to tons of community members. So if we do webinars with them and share our resources with funders, then we can even increase the reach of our information and the message. And then what I'll go in depth into today is what we did with California Protecting Immigrant Families Coalition. We've been a part of this coalition since the public charge rule was first leaked. And it's been a really amazing partnership between, so many different types of organizations. I think that's kind of the silver lining of public charge really, is that it brought together, anti-hunger advocates, anti-poverty people, immigrant rights, health advocates, education. Everybody came together to kind of fight this rule, and it created a very strong partnership that helped us respond to COVID-19. And then we're also part of the California Anti-Hunger Coalition, right, which has our San Diego partners in it. So we get to hear about all the great work that they do through that coalition membership. Next slide. So the California Protect Immigrant Families Coalition has several work groups, and one of them is the Outreach and Communications Work Group. And this is, the goal of this one is to mitigate the chilling effect of the rule by creating a coordinated messaging strategy. So, you know, there's so many different public charge flyers and messaging from the state, the school, whatever they come from. So we wanted to find some kind of cohesion across the state and even create resources that could be recognizable, right, like a brand. So that's why we got this logo made for our coalition, and hoping that the more that folks see it, the more that it becomes a trusted brand in itself. So we originally, but pre-COVID, we're focusing on service provider trainings. These were, you know, like longer, directed at advocates and healthcare workers. But we started to realize that, you know, after a full day or even a half day of information, we saw people's eyes glazing over, and it was pretty heavy policy content. And you know, what's most challenging is people were coming away just worrying that they don't want to accidentally give legal advice and then, you know, jeopardize somebody's immigration status. It's a huge responsibility. And so they were requesting that we need something simple to hand out to their clients. And we were hearing from other partners that the same thing. So we created a new focus for our community trainings. And this we did in partnership with consultant Hector Plasencia, who I'll speak more about. They were awesome. And this has a training component, but also handouts and social media and things that are just shareable and making it easy for our outreach partners to spread the message. So our service provider trainings, we did 6 in-person ones and 2 webinars over like a year, so a total of about 800 participants. But just in the last few months, you know, since the pandemic began, we did 2 two-part webinars. So we break the community education up into a 1-hour webinar one day and a 1-hour webinar a second day. And we already have over 2,400 views on those presentations. So the virtual aspect definitely increases the reach, and we're hopeful that the way that we go about it, the way that we incorporate community voices and really bring partners on is the best way to really increase that reach. And one of these trainings was conducted by the Inland Coalition for Immigrant Justice, so we're super excited to have Lizette on to talk more about exactly what she did there. Next slide, please. All right, so we're very excited. This is our fresh new resource, the Immigrant Health Packet. So this is the culmination of tons of work directed by Hector Plasencia of Plasencia Consulting with the help of the PIF California Work Group and immigrant experts. And the immigrant experts are grassroots coalitions who, you know, are employed, staffed by people who are immigrants themselves and have a lot of experience in the world. And they helped us inform and work on our messaging. So the packet has 3 different components. It lays out the healthcare system and tries to help people navigate that, you know, very complex and overwhelming system. Then the free and affordable food, that's the one that CSPA helped design, which lays out what's available and what the public charge concerns is, basically like a mini version of Renato's presentation. And then Stay Healthy, about COVID-19 resources and public charge considerations. So you'll notice that instead of creating public charge flyer, we shifted away from that messaging. It's more about what people want to hear, right? What people are curious about, and that's systems and how to engage with institutions and what they're actually eligible for, and creating a message that's comforting rather than stressing risks over rights, right? So these are the guiding principles that Hector wanted to apply. Number 1, develop with immigrant experts, right? It's so key to listen to people and to what they want to hear. And that means being intentional to focus on what's important to your audience. Maybe, you know, the in and outs of public charge policy and what's happening in the courts and when we signed that and who did that, maybe that's not important. We should focus on what is actually relevant. Accurate translations. We have this in English, Spanish currently, and it's coming soon in Tagalog, Vietnamese, and Chinese, Korean. And we use a community review process to make sure that those are accurate translations and the messages getting delivered. And most importantly, we simplify for our outreach partners. That means giving community presenters everything they need to confidently deliver the message. You know, with the service provider trainings, it was us, it was advocates who were leading them. But in this project, we're really focusing on doing preparations and providing talking points and getting the community-based organizations like Lizette feeling confident to affirm their expertise as experts in immigrant issues and to make sure that they're ready to do it and to compensate them, right? We all know that community-based organizations are always working at capacity. And the more that we can compensate them for their work, the better that we build a reciprocal relationship that sustains this movement. Okay, next slide, please. So here's the food flyer, a breakdown. You'll see that it leads with what is safe and open to all. That's the key message, right? You can have all these programs. CalFresh is the only program with immigrant restrictions. You don't need to worry about WIC and all these other amazing programs. And then the second is showing what CalFresh is and why it's good for you. CalFresh keeps you healthy. These are all the benefits. Go to getcalfresh.org to see if you qualify. And then at the bottom, we have CalFresh and public charge. And here's the considerations. And we're stressing the message. This is what we're trying to get across, right? If you're eligible for CalFresh, in most cases, public charge does not apply to you. That's a key takeaway. And next key takeaway is if you're not eligible or if you don't even want to apply, you can get it for your citizen children and other qualified immigrants in your household. These are the mixed status households that we were talking about earlier. And this is where we see a lot of drop off. It was a huge chilling effect that what we call in California child only cases, right? Households who are only getting CalFresh. We saw a huge drop in that when the public charge rule came out. And we really want to stress that it is safe for mixed status families to get it for their children. And we have at the bottom our link to our screening tool, which is a really amazing tool that we partnered with folks all over California to create. It's a simple website. You can just put in your information and follow the questionnaires, and it'll tell you whether or not public charge affects you. Next slide, please. So here are all the elements of the immigrant health packet. I told you before we have the 3 types of flyers, the food, the health, the COVID. And for each one of those, they have a handout. It has a section on the PowerPoint, which we give to partner organizations to customize, put their own organization header in and all that. It came with Instagram and Facebook posts, these nice, perfect Instagram-shaped breakdowns, which is the flyer, but is ready for social that we shared our partners out. An outreach toolkit with tweets and graphics so that our partners and advocates can share out the resource. And these little half sheets, and this is just the core of the main takeaways that we want folks to take away. And these are like made with the idea of you can hand these out at food distributions or other people are getting other services. Quick little sheet. It has all of the programs immigrants are eligible for regardless of status, those that require some status, and then tips on public charge, where to get the services and all that. Simple half page. So we're really proud of making this, but the work's not over. As I mentioned, we're still working on getting those translations. They're in the community review process right now. And then next, we're going to really want to focus on creating an outreach plan for specific communities. Now we're going to have translations in Chinese, Vietnamese, Tagalog, but our strategies for English, for what we use to get out the English and Spanish versions, probably aren't going to apply for these communities. So we need to build those partnerships and really make sure that we're reaching the people that we think we are. Funding, of course, always in need of more funding. Funders out there, we really need to compensate our outreach partners, right? The folks who are on the ground doing the work, who are overburdened with the work, and it's heavy stuff, right? They're in the community seeing people face to face having to endure such hardship that we really need to be compensating. And it's hard for nonprofits like us to share any of our money, so we need to be able to pool resources together that we can do that. And I'll share more about how San Diego Hunger Coalition actually did that successfully. And engage media, right? Just find more ethnic media, find more ways, more channels to get out our information. Okay, next slide. Next slide, please. Oh, like a slow transition. At a fade, okay. So now I wasn't able to invite them to come speak because, you know, there's already a lot of voices here. Can we go one back? But the San Diego Hunger Coalition did some amazing work around PEBT outreach. They created a flyer, you know, that's specific to San Diego, and they translated it into 16 languages. There's a lot of languages spoken in that area. And they sent out these a blast of outreach materials that included those flyers, sample text that partners can use for robocalls, email, or direct text campaigns, a social media toolkit, right, with all the tweets, and they email blasted this information to a ton of partners, community-based organizations. But what they really did that I think was amazing was compensated folks for doing their own outreach. So let's go to the next slide. They were able to get $32,000 in grants to give out to 8 different organizations and coalitions. You can see their logos there on the right, to support resident leaders in delivering the information, right? We can share these outreach toolkits and ask people to share widely, but it's work. So these people got compensated, and it really increases the reach. This is just more of the methods, and they were able to reach 60,000 households with this approach. Next slide. And these are some of the takeaways that Amanda let me know about the San Diego Hunger Coalition. And y'all can read those later in the slides because I would like to pass the mic to Lizette. But just I think that the big thing is, you know, valuing community voices and really encouraging their participation in the whole process, right? Getting buy-in and then compensating them for it. It really pays off in the end. So I would like to introduce Lizette Mendoza to talk about how all of these strategies got implemented on the ground in community.
Thank you, Gabrielle. So I think it's like maybe 2 slides over where I can begin, or actually begin here. As mentioned earlier, I'm part of the Inland Coalition for Immigrant Justice, so about 2 counties away from San Diego, where folks are doing this great work, and not too different, right? But just to highlight a few things, right? I think a lot of our folks, when the pandemic hit in early March, we were, you know, staying after hours, trying to figure out how we would really just work with the structures that we have of people and the relationships to move fast. And so we convened a meeting with a lot of our local partners and our informal partners, if you will, to figure out what our plan would be, and form this committee that would look at the limited resources that are in the region, to get them up in front and center of these communities that we know were already I am back. Sorry. I think I got logged out, right? Sorry about that. Let me see if it's my connection issues, but I'll be quick anyways. We identified trusted messengers, right, in our coalition, who are in different parts of these 2 different counties, San Bernardino and Riverside County in Southern California, and realized what capacity they had, and you know, who else we could bring to the table to pass out information about the local food banks, or other free services that were being given during the pandemic. And so one of the strategic things that helped this work is that folks were already making calls and had already been canvassing their neighborhoods around census, right, and the importance of census getting filled out. And so As soon as this hit, I think within a week, folks continue to conduct their phone banking efforts, but they would do phone check-ins to see what folks needed, and if they needed to be redirected to a specific resource. And so, or, these handouts that Gabrielle and other folks have shared around protecting immigrant families, making sure that they got the link to it, or that we could even take it to their door if needed. So that was all key to making this happen. Next slide. And so some of the partners here at the very top are just a few of the trusted messengers that are within our coalition that would go out to these public spaces where folks were continuing to attend, and just taking the information about Pandemic EBT connected with the public charge message, right? The community facing messages, sending out text blasts to the thousands of contacts that we all have collectively, and creating a conversation with them as well through that texting banking to ensure that folks don't feel like it's just something false or a scam, right? So there was at least 5 texting leads or more per organization at points to ensure that folks got the message and got it in their language. And so working with those key partners and key leaders is a continued effort to see, like it's in any campaign that we move towards now to get folks the right information. And then fortunately, we were able to get our own regional fund going here in the Inland Empire. And so whenever we would do the fund drives, you could kind of see a picture here on the slide, as cars would drive through to get their money cards. At the same time, we would promote, whether it be census or a public charge message, just a quick, like, what could we say in 30 seconds or maybe a minute while we're with them, confirming their cash card information that they could take and really, hold on to during this pandemic. So that was interesting. And we're actually going to have another money fund distribution this Saturday. And so we're already planning what messages need to go out that day, and create packets with their goodie bags as they drive through our facility. Next slide. And so there's a lot of digital reach that, we had to build on. Thankfully, we have some, great platforms with all of our trusted partners, but knowing the ones that are on the ground and are actually recognized by logo or by name, these are the folks that needed to help us really do, cross posting and texting everybody, hey, it's going to go live at 6 p.m. tonight. It's going to go live at 9:30 a.m. while parents are coming together for their parent meetings that ended up living in this virtual space, or even, ensuring that they had the phone number to call in to just listen in, right? So we identified key times where folks could tune in to get the information, or to remind them it's going to live in this page. You can reshare it. You can text the link to somebody else you would know that needs the information. So really working with our communications team, with youth, right, who just know how to navigate these systems a lot better for their families. And then if it didn't work in the digital space, we had to go out to these key public spaces. Again, we work with folks that work with day laborers. And so there's a picture here at the bottom where we're in the city of Riverside, going to these key corners where day laborers are at and literally helping them fill out the application for the fund, calling, I don't know, the WIC office or whatever it may be, and just having kind of like a street team that could actually give the information. And as Gabby said earlier, it is a lot of work. So if it could be compensated, it's always best. And so we try to work with, the partners that have that strength. But of course, if it's not, then we create it or we find the funding for it. And I think I just have one more slide, and I'll be quick with this one. That, we have partnerships with our local assembly members and our, senators, and sometimes our board of supervisors, but, even the local colleges can make a great difference. So when there was school giveaways, school supplies, some of our partners gave away, old desks or created desks In these school giveaways, you can also continue to give the information and the right message to folks that are directly impacted. And so we want to make sure that we utilize every resource that we have, even if it may be small in our community. So we thank you for listening, and I'll stop there today.
Thank you so much, Gabrielle and Lizeth, for helping us to understand from a frontline perspective how you're helping and working with the immigrant community to access benefits, but most importantly, to help address the food insecurity among this population. So I'm going to just take a moment of privilege here, and I want to thank my colleague, Asubalu Dadi, who organized and has coordinated this presentation and this webinar, who really has done an amazing job of helping us to understand the broad policy implications of the public charge rule, and to help us understand the data and how immigrant communities are responding or not accessing benefits, and then to help us understand the community perspective. So thank you, Asubalu, for your thoughtful approach in putting this together. We really appreciate you doing that and bringing this information forward. Before we go any forward, any further, I think there's just two questions that we received, and I want to make sure that we clearly answer these questions. And Renato, I'm going to ask you to help us here and ask the panelists to turn on their videos at this time. We received a question, and all of us who are in the mix and who've been tracking public charge rule and all of these issues, we use this language and terms so easily, and we all know what they mean, but wondering if you could help us and dive a little deeper just to give us an overview of what a mixed status family is. And we've used the term chilling effect throughout this conversation, but I want to make sure for all of our colleagues and friends on the phone who don't use these words regularly, if you could just give us a baseline understanding of what they are.
Sure. Hi, folks, again. So I'll start off with the mixed status family. What's considered being a mixed status family? The most common example. So essentially, it's a family with different immigration status, where generally speaking, a parent could be undocumented, they can be a legal permanent resident, they could have a different non-citizen category, and the child could be a US citizen. So this is an example of a family with different different immigration categories. So that's mixed status immigrant family. So when we say that, you know, that in its most basic form, it's a family with different immigration statuses, but generally speaking, it's a family with a US born citizen child and a parent that is a non-citizen. The chilling effect term, broadly speaking, is a term that's used to describe behavior that's been documented since the 90s, essentially, that shows that when immigrant individuals are eligible for programs, because of immigration-related concerns, they decide to either forego applying to public benefits or disenroll from those public benefits because of immigration-related concerns. So in the context of public charge, individuals who are eligible for these public benefits are disenrolling or deciding not to enroll in public benefits. And we're broadly describing this behavior as a chilling effect.
Right. Thank you for that. I know we use these words all the time, and you know, we sometimes forget that not everyone is using these in their everyday vocabulary in the ways that we have. So all of you talked about something that I thought was really interesting, and you know, I was intrigued by the way Gabrielle and Lizeth have used different modes to share information, and I think Hamutal, you've talked about you know, just the chilling effect and the impact the announcement of that policy has had on immigrants accessing benefits, and even for eligible immigrants. So I guess the big question that I have here for all of you, and feel free to jump in with your different perspectives, is, there's a lot of confusion and misinformation about the public charge rule and who is eligible and who isn't eligible. And so I'm just curious about, in all of your work, what sources of information do immigrants rely upon, and what do they trust? What sources of information do they trust? And I'll open that up to the panel. Hamatal, if you want to start first, that's fine.
Yeah, I'm happy to answer that because we have collected some survey data specifically on that topic. So we have at the Urban Institute an annual survey called the Wellbeing and Basic Needs Survey. And the last few years, we've been able to do a special module on immigrant families, and we asked about experiences disenrolling or not signing up for benefits, but we also wanted to dig into where people are getting their information. So, and we picked up on this in other work we've done too. We've done some qualitative interviewing with survey respondents. So some of the things that came out of the survey just really quantify the extent of the misinformation. So for example, only 1 in 5 adults in immigrant families who reported avoiding some of these benefits knew that their children's receipt of benefits would not affect the parent's future public charge determination. And that's among adults that actually said they were somewhat confident in their understanding of the public charge rule. Mm-hmm. That really quantifies how much misunderstanding there is. It's really the vast majority of people who don't understand that there are a lot of people who should not be concerned because they won't be directly affected. Similarly, I think we had a similar result. Around 1 in 5 did not understand that it wouldn't affect your citizenship application, which is, as Renato mentioned, a very common misconception. So we asked in this survey where people were getting their information around benefits and implications for immigration. And what we found was that most people get their information from personal networks and media, but they have the highest trust. The sources they would trust the most for this information is government agencies and legal professionals. So we saw a total disconnect between where people were getting their information and the places that they say they would trust for accurate information on these topics. I was absolutely fascinated to hear this nitty-gritty about how your organizations in California are getting people information. So interesting to hear all this innovation. So this, one of the kind of interesting findings from this survey was that a very small share of respondents said that they were getting their information from CBOs, from immigrant-serving organizations. So to us, it points to the disconnection of many, many families from these networks. On the other hand, I think what I heard from you all and would love to hear more about is how you're taking this information from the CBO and then turning it into, right? You're putting it into people's personal networks or putting it into the media. And if you can get those accurate messages out to those other platforms where people actually are, say that they're getting their information, that's fantastic. So I'd love to hear more.
Great. Gabrielle, Lizeth, want to expand on this question a little bit more?
Yeah, I think definitely if folks are saying media, that's key on what we're hearing out here, and so it'd be important to have the right attorney speaking about this in the media, right, and in multiple languages. And then it reminds me of also a comment one of our communications person said that at the beginning of the pandemic and just like last week, that what if there was a medical professional well, talking about COVID messaging, right? More so COVID messaging tied to public charge and how that would look like. What would the difference be if somebody in a lab coat or, you know, with the title of a doctor or of an attorney make a difference? But yeah, even on the radio in this region too, folks listen to a lot of radio, whether it be during work or out, you know, in different um, work that they do, whether it be in the fields or warehouses or et cetera. Folks still listen to the radio. So we've been talking about how to, I know it's been used a lot around census. I can't remember the last time we talked about public charge on the radio. But you know, again, having the right community facing messages, as it was highlighted, I think from the moment, you know, even Renato started presenting, so that they take that, right? They take that good information, or as we say sometimes in our, you know, folks are starting to use the word chisme a lot, right? If they take the right rumor, the right, the right talking point, it's almost life-saving for our communities, right? And so, and it is, I would say, because again, you know, it'll put folks into the right path of resources or you know, et cetera. So, can't think of something else. I think I lost the other thought there, but you know, I think if we continue to build on these innovative ideas and also ask them, as Gabby mentioned earlier, like even just locally, right? You know, we take a temperature check or a survey locally of what to do, and that's what we had to do throughout the pandemic as soon as it started, to kind of find out what other ways could we get the information to folks, whether if they don't have Facebook, right, then where do we go physically to give the information, or how do we partner with the local WIC office to dispel these rumors, and work with the county government, right, to ensure that they have this toolkit, which I know there's been a lag on our end locally to get that information out. But all of these trainings that were being done pre-COVID, the physical space and then the virtual world has at least informed some of these frontline workers that are you know, facing the community, and being able to educate them is key. Even medical students, right? Just last week we had a presentation with medical students and some of the providers, so that they are also knowing how to guide their clients, or what they can post in their local clinic, whether it be a drive-up service or a virtual check-in, that this information is getting out. So I think there's still room to keep playing with how we get the messages out, and definitely taking into account what has been learned here through the survey that y'all have done.
Thank you so much. And to be clear, chisme versus being a chismosa is different, right? So it's always important to get good chisme. But I really appreciate the work all of you have done on the ground and working with the county and with the state governments. But to be fair, not all local and state governments have the same interest to work cooperatively to help debunk myths and to address and make sure people are getting the right information. So Renato, I want to bring you in a little bit, and as well as the other panelists, like, what are some of the policies that we could think about to help mitigate the chilling effects of the public charge rule, recognizing that, you know, I think California sometimes stands out in terms of its willingness to want to work and help the immigrant population?
Right. So some ways, from the federal like policy context, like some ways to mitigate the effect of public charge policy. Like the first one that comes to mind, obviously, is rolling back the public charge regulation. The recent changes over the last couple of years of public charge. I think that's a top policy consideration. Another is expanding eligibility to programs in the context of SNAP, making all lawfully present immigrants eligible for SNAP. This would get rid of an entanglement about who is a qualified immigrant. And also outside of SNAP, expanding eligibility to immigrants for other public benefits, in the context of COVID-19, that's expanding eligibility for those who have an ITIN, not a Social Security number, but an ITIN to get stimulus payments. So that's another way to help mitigate, is also to expand eligibility to public programs. And then the last piece, I'll just flag again that in the slide when I talked about WIC, the practice of not having to go into the office, being able to get benefits remotely, does mitigate chilling effects. Individuals are, fearful about potential immigration enforcement, fearful being physically present in a government office, and not having this barrier preventing them between, having access to food and putting that on their table and having to go into the office. That does help mitigate chilling effects. And in a post-COVID-19 context, that's something that would certainly benefit immigrant families.
Yes, and I would just like to add, just like Renato was saying, like all of these flexibilities that were added post-COVID are basically what advocates have been asking for a long time. It's like limiting the requirements of getting on these programs, because every time you interact with the government, there's more opportunity to feel nervous, and there's more questions and more requirements, and this kind of builds up the fear of engaging with government institutions. And so, yeah, all of those things, the simplified application reporting processes are really important. Same thing with language access and cultural appropriateness. Just the more that we shape our programs to be inclusive, it'll really create this change over time.
We're going to do a lightning round here. And, I'm going to quickly kind of just do a quick wrap up. And I want to close with each of you providing very quickly, basically for all of your organizations and what you're seeing, could you please underscore why it's so important that we meet the needs of immigrant children during this time? So I'm just going to, let everybody know who's listening in that we have recorded this webinar. It will be available. And again, kudos to my colleagues for pulling this together. And so, Gabrielle, I'm going to start with you. If you could just underscore why it's so important that we meet the needs of immigrant children.
Yeah, simply because none of us are well until all of us are well. Health is not just a single person, it's an entire community, and we need to protect every single one of us.
That's great. Thank you. Lizette?
Because I think everyone, it needs to have dignified access to care and to resources. And, it's essential for again, our lives are at risk. Their lives are at risk a lot more. And, facing all these other attacks on top of, getting stripped from resources should not even be the case in the first place.